Hey everyone, Dr. Lloyd Stegemann from the Better Way Center in Corpus Christi, Texas. I want to discuss with you today some of the things that I would call myths of bariatric surgery. Things that have been around for a really long time that I just say, really not sure about that one. Now, not every program is going to agree with me, so I certainly encourage you to follow what your program says, but I'm going to give you my thoughts on some of these things that I hear in bariatric surgery. One of those is, I can't chew gum after my bariatric surgery. I've always said why. Why is it that you can't chew gum after bariatric surgery? In fact, there's some data that shows chewing gum helps control appetite. So why is it that you can't chew gum after bariatric surgery if it potentially helps you control your appetite? I've never actually heard anybody explain why you can't chew gum. I've heard people say, oh, well, I had a patient who had an obstruction after their gastric bypass from a piece of gum. Really? I've never seen that. None of us should be swallowing gum in the first place. Okay, but I've never taken a piece of gum out of a patient. So for me, I'm perfectly fine with patients chewing gum. I do encourage them to chew a sugar-free gum versus a sugared gum. Again, it's a minor amount of calories that you're getting in, but just the overall principle in our program is to really try to limit sugar intake. The second thing I hear, and I hear this in every program, is you can't drink through a straw after bariatric surgery. Again, I have no idea where this came from. Certainly most people take in a little more air when they're using a straw, so it may make you burpy or feel a little bloated if you're doing it, but there's no danger to using a straw after your bariatric operation. Again, not based on any data whatsoever. It's just a myth that we were all taught and we all seem to teach for some reason. One, I don't teach my patients because, quite frankly, I just don't believe it. How about carbs? That's another one I hear quite frequently. You can't eat carbs after your bariatric operation. That's always been an interesting one to me. So that means I can't have fruit, I can't have vegetables, most vegetables. That doesn't seem like a great idea to me. I only get meat. Well, we don't eat like that. And in fact, if you ask most weight loss expert, what is the best eating plan out there when you're looking at keto and Mediterranean, all of these different ones, most people are going to say that the Mediterranean plan has the best mixture of proteins, fats, and carbs, and is probably the best eating plan out there that most people can follow. Well, in the Mediterranean plan, it's almost 50% carbs. Carbs are not bad. The type of carb that we choose makes a big difference. And so we talk a lot about frequency, and amount is probably the most important thing when it comes to carbs. But can you have carbs? Absolutely, yes. Drinking and eating at the same time. Now, this is another one that we're all taught, and I just can't find any data to support it. And it makes sense to me from a physiologic standpoint why that might be. Certainly for gastric sleeve patients, you worry that the food is going to be sitting in the sleeve, and when you drink the liquid, it can't go anywhere. And so oftentimes those patients will get a little heartburn or reflux if they're drinking with meals. Bypass patients, we worry about washing the food out, and patients getting more hungry more frequently or being able to eat larger amounts when they're drinking with their meals. But I got to tell you, there's never been a study that I'm aware of looking at success rates in patients who drink with their meals and those who don't drink with their meals. And I've certainly had a lot of patients who are a number of years out maintaining their weight loss and drink with their meals all the time. So for me, it's not a hard and fast rule. What I will really talk with patients about is I'm fine with you sipping during the meal. Something's dry, something's spicy, have a sip. But I certainly don't encourage you to drink an entire glass of liquid while you're sitting. But again, certainly no data behind it. And lastly, the last one I want to touch on is drinking soda, or I would just say carbonated beverages. You'll see videos where somebody takes a bottle of soda, they put a balloon on the top, they shake it up, and this balloon all of a sudden starts to get bigger, and they say, this is what happens to your pouch or your sleeve when you drink soda, so you should never do it. Simply just not true, and it's not physiologic. What they're creating is a closed system. Your body, your GI tract, is not a closed system. And so you are not going to stretch out your pouch. I don't believe you stretch out your pouch, stretch out your sleeve by having soda. Just physiologically does not make sense to me. Now, I can make a strong argument why sodas are not good for us, whether that is a calorie soda or a non-calorie diet soda. I can make a strong argument why neither of those are great for us, especially if we're doing it on a regular basis. And I think that's the key. And so what I will teach patients is that if you're going to have a soda, I would prefer you not do it with a meal, and I would prefer that you not do it frequently. We also know that when we're taking in sodas, whether that's regular soda or diet sodas, it tends to drive sweet cravings. And so if you're finding I'm really craving sweets, getting rid of the soda, diet or regular, will certainly make a difference there. So these are the few of the myths I wanted to touch on today. I hope you enjoyed that. If you like it, please hit subscribe, come back, see us again for lots of more good information.